the mitral valve. Now, this is between the left atrium and the left ventricle. Why is it called the mitral valve? Because it resembles the bishop's mitre. Now, the bishop's mitre, as you see, comprises of two leaflets, and because it is bicuspid, it is called the mitral valve. It comes from the word Latin mitre, meaning a bishop's hat. The word bicuspid comes from bi meaning double and cusp meaning pointed, reflecting the dual flap shape of the valve. Now, this is the left atrium, that is the left ventricle. All the blood from the pulmonary system, after getting oxygenated, it comes into the left atrium, goes to the left ventricle, and when the ventricle contracts, the blood goes via the aorta to be distributed to the rest of the body to give it the oxygen which it so much craves for. Now, look at the mitral valve, the two valves, how they open and close, and how they are anchored by small finger like processes. Continuously, they are doing that. When we look from above, this is the mitral valve opening and closing. You see on the left side the mitral valve open and close. This is the mitral valve. It is known as bicuspid. It is a valve with two flaps in the heart that lies between the left atrium and the left ventricle. The mitral valve and the tricuspid valve are known collectively as the atrioventricular valves because they lie between the atria and the ventricles of the heart. There is the mitral annulus, which is a fibrous ring that is attached to the mitral valve leaflets. It is not continuous. The mitral annulus is saddle shaped, changes in shape throughout the cardiac cycle. The annulus contracts and reduces its surface area during systole to help provide complete closure of the leaflets. Expansion of the annulus can result in leaflets that do not join soundly together, and this can lead to functional mitral regurgitation. That is the annulus, like a C, but you will observe it is not a complete ring. And here there is a connection. The mitral annulus again is a fibrous ring that is attached to the mitral valve leaflets. As we saw earlier, it is not continuous. It is saddle shaped, changes in shape throughout the cardiac cycle. Expansion of the annulus can result in leaflets that do not join soundly, leading to functional mitral regurgitation. That is the annulus. The normal diameter of the annulus is 2.7 to 3.5 centimeters. The circumference is about 9 centimeters of the mitral annulus. Microscopically, there is no evidence of an annular structure anteriorly. You see, it is incomplete here, where the mitral valve leaflet is contiguous with the posterior aortic root. This shows the mitral valve. Now, it is anchored by finger-like processes called the chordae. Now, they are visible as white strings. These connect to the papillary muscles. These are the papillary muscles attaching to the muscular ventricle. They are called chordae tendineae. The valve leaflets are prevented from prolapsing into the left atrium by the action of the chordae tendineae. The chordae tendineae are inelastic tendons. These are inelastic tendons attached at one end to tiny muscles called papillary muscles in the left ventricle. Now, to the other end, it is attached to the valve cusps. Papillary muscles are finger like projections from the wall of the left ventricle. Now, these are the papillary muscles. That is your heart beating. Look at the valve, look at the papillary muscle and the chordae tendineae. When the left ventricle contracts, the pressure in the ventricle forces the valve to close, while the tendons anchor and keep the leaflets coapting together and preventing the valve from opening in the wrong direction. If that happens, blood can flow back to the left atrium, and this is prevented by the chordae tendineae attaching to the papillary muscles. Each cord has a different thickness. The thinnest ones are attached to the free leaflet margins, whereas the thickest ones are attached further from the free margin. That is the papillary muscle. And these are the finger-like chordae tendineae. The thinner ones are attached to the margin, the thicker ones beyond the margin. And these anchor the leaflet, preventing it from prolapsing back. During left ventricular diastole, when the ventricle dilates, after the pressure drops in the left ventricle due to relaxation of the ventricular myocardium, the mitral valve opens and blood travels from the left atrium to the left ventricle. 80% of the blood that travels across the mitral valve occurs during the early filling phase of the left ventricle. The early filling phase is due to active relaxation of the ventricular myocardium, causing a pressure gradient that allows a rapid flow of blood from the left atrium across the mitral valve. This early filling across the mitral valve is seen on Doppler echocardiography of the mitral valve as the E wave. Now, what are the problems associated? There are some valvular heart diseases that affect the mitral valve. Mitral stenosis is a narrowing of the valve. Now, this can be heard as an opening snap in a heart sound which is not normally present. Classic mitral valve prolapse is caused by an excess of connective tissue that thickens the spongiosal layer of the cusp and separates collagen bundles in the fibrosa. Now, this causes weakening of the cusps and adjacent tissue, resulting in an increased cuspal area and thereby lengthening of the chordae tendineae. And once the chordae tendineae gets elongated, it often ruptures, commonly to the chordae attached to the posterior cusp. A valve prolapse can result in mitral insufficiency, and this is a regurgitation of backflow of blood due to the incomplete closure of the valve. Rheumatic heart disease often affects the mitral valve. The valve may also be affected by infective endocarditis. When that happens, what can we do? Surgery can be performed to replace or repair a damaged valve. A less invasive method is that of mitral valvuloplasty, and this uses a balloon catheter to open up a stenotic valve. We have now seen a comprehensive discussion about the mitral valve. One common syndrome that happens is the Barlow syndrome. Barlow syndrome is mitral valve prolapse, also known as click murmur syndrome, and this is the most common heart valve abnormality affecting 5 to 10% of the world's population. Most patients have no symptoms and therefore require no treatment.